Since the coronavirus made international headlines, stores all over the Twin Cities have sold out of face masks.
But Kathy from Blaine wanted to know, do face masks really work? Good question. Heather Brown explains when they're helpful and when they're not.
Inside St. Paul Corner Drug, on a bottom shelf, is an empty space where the face masks normally sit.
We ordered from our suppliers and now they're out of stock.
Pharmacist John Hessian says the last time this happened was the 2009 H1N1 outbreak. Before that, it was SARS in 2003.
I don't want to say panic, but they get concerned because it's something new. And we also had some people that were looking for product to send overseas to relatives and stuff that live in China.
The CDC is confirming a 13th case of coronavirus in the U.S.
The relative risk to the public is very low.
Jacy Walters is with the Minnesota Department of Health.
Do the masks work?
Well, for a person that's not ill, it's not going to do anything. We don't recommend masks for other respiratory viruses, and so there's really no need to start doing that now.
The reason you see doctors or nurses in hospitals wear these masks is because they do offer some protection against droplets, say from a cough or a sneeze, get out into the air and near the patients. But these don't do much to filter out those tiny particles.
To really filter those, you'd need a different mask, an N95 respirator, which has a filter and requires special training.
N95 masks are really reserved for healthcare workers.
The CDC recommends flu patients who are coughing in healthcare settings wear a surgical mask. So should the healthcare workers within 6 feet of them. But outside of hospitals or clinics, the CDC doesn't recommend masks, saying they may not effectively limit transmission, except if you're coughing with influenza in confined public spaces, like this McAllister student whose school gave him a mask.
But you had to come here to pick up the medicine.
Yeah, I did, yeah.
And then where are you headed from here?
I'm just headed to back my room, yeah.
Our basic guidance is, if you are sick, please stay home and be sure to cover your cough and wash your hands and get your flu shot.
In St. Paul, Heather Brown, WCCO 4 News.
Heather reached out to 3M. It makes many of those respirators for hospitals. The company says it is ramping up production right now because the demand in countries like China exceeds the supply. If you have a good question, please email Heather by going to WCCO.com/links.